Hello, my name is Vanessa Benjamin Roos. I moved to Granby, Colorado in Grand County from Manhattan, New York in December of 2009. And I'm about to share my mental health story, the struggles and successes. So I'm sharing my story in regards to the difficulties in finding a therapist or specialist in regards to my diagnosis of PTSD, post-traumatic stress disorder, DID, dissociative identity disorder, and major depressive disorder, or MDD. And I also deal with Stockholm syndrome. So finding a therapist who specializes in all, if not a few of those diagnoses would be great, because if you're dealing with a therapist that's not knowledgeable, you're not getting the proper treatment for your diagnoses. And finding a specialist here in Grand County has been very difficult. Back in New York, I wasn't really properly diagnosed, so I was only getting a certain amount of help for certain diagnoses. But being properly diagnosed in 2011, finding a specialist nearby or locally in Colorado has been a difficult task. So the most difficult part of finding a specialist is to have a specialist that would be able to find housing to house them. Affordable housing is a difficult issue here in the county, so if I were to have someone here that could help with my needs, housing could be an issue. It's been incredibly difficult to find a specialist for my diagnosis here in the county. Also, the hospital, the inpatient hospital, is over 4 hours away, and that's really dependent on weather. There's only one facility here in the county that, if you're uninsured, they have a sliding scale fee. I'm not very familiar with those who have insurance that can see someone privately, but for someone like me who is uninsured, I only have one place to go to. There's a long wait time to get to see a therapist and a psychiatrist, and the frustrations are high in regards to getting the specialized help that I need in a timely fashion. So one of the biggest difficulties when you need inpatient care at the hospital is 4 hours away, and that's depending on weather. Now, if you don't have reliable transportation or a family member can't drive you, you would go to the emergency room and you would be placed on an M1 72-hour mandatory hold. From there, a police officer would have to drive you to the hospital in Grand Junction. So if you've had a traumatic experience regarding law enforcement, that will add onto an already stressful situation. Also, being so far away from family and being, let's say, inpatient for the first time, the whole experience could be very traumatic for the individual dealing with that crisis. I find that a really difficult issue when it comes to care, inpatient and so forth, is those who are uninsured. There are a lot of employers up here, mom and pop shops, who don't offer health insurance. So paying out of pocket is incredibly difficult. Also with the rising cost of gas and groceries and so forth, you're wondering whether or not you should eat or go to a therapy visit because you have to pay out of pocket. And here in the county, there's only one facility that will work with you on a sliding scale fee if you're uninsured. Then you also have to deal with the cost of medications. You could get a prescription card from Kroger that will help you lower the cost of prescriptions, but it's really difficult for the uninsured and even the insured to get mental health treatment on time. You can have all the resources that you have financially, but seeing someone could take weeks to months, and that's a huge barrier as well. I want to educate and advocate for those that need to speak up so they can advocate for themselves and friends and family. It's so important for people to understand that we are like everyday people. Everyone has struggles, some worse than others, but when we work together, when we work in conjunction with each other and we continue to educate and advocate, we can all work together to pretty much make any environment a safe and more happier place.